Mics are going hot.
Gotcha. Dave Barron. Nice to meet you. Yeah, thanks for being here today. We'll get going in 1 second. You hear from anybody else? RB?
Because we're the we're the three organizations. This is
Victor still in Thailand?
Yes, he's still.
He is still in? Okay.
Maybe move there.
And then where is he in
He's
Florida?
gone until later this week.
Okay.
Well, she
All right, we are going to call this meeting of the Community Development Committee of the City Council of Kankakee to order on this December 2nd, 2024. The time is now 6:05. We'll begin with the public comment. If anybody is here to make a public comment, now is the opportunity. We ask that you come to the front. Comments are limited to 3 minutes. Please direct your comments to the chair. Seeing no one for public comment, we'll move on to roll call. Alderman Prude, Alderman Barron here, Alderman Osenga, Alderwoman Swanson, Alderman Navarez, Alderwoman Johnson,
Here.
Alderwoman Noble. Here. All right, we have 3 present. We do not have a quorum, so we will not be able to act on any of the items before the committee. But we will probably be able to hold most of the bills over. Anything too pressing?
We will be okay.
Okay. All right. 1 second, let me make a note. And I'll note that also present is Alderman Marzak from the Fighting Fourth. With that, we can move down the agenda. November 4th, 2024 meeting minutes. We don't have those presented, but we're going to have those to present to council 2 weeks from tonight. Then also, we have the draw vouchers as presented. You should have received them earlier today for a total amount of $179,017.61. Even if we don't have quorum at this point, do you want to give any color for them or commentary at this point?
I'm going to have to hold this. Just to point out, obviously, this is a larger set of bills than what you may be used to from us. There's some salary reimbursements, some personnel expenses in there from lead grant going over to the city side. Also from Healthy Homes is in there. The bulk of the expenses that are larger are rehab projects that have been completed and paying the contractors out for those projects. So you'll see lots of salary reimbursement to the city from the grants, and then, of course, the contractors for projects. So that's pretty much the biggest parts of this set of bills.
Okay. If you could take a look, we will look to adopt those at the next meeting in January. So with that, next on the agenda, we're happy to have representatives here from the Steering Committee of the Partnership for a Healthy Community. Would like to invite specifically Kara Becker from the Kankakee County Health Department. She's the Health Promotion Coordinator, as well as the Emergency Response Coordinator for the Health Department, for the Public Health Department. We have Matt McBurney with Riverside Healthcare, who is the Vice President for Public Relations and Communications, as well as Otis Story, who is the Chief Executive Officer for Ascension St. Mary's. Thank you all for being here. This sounds like a very interesting process and findings that you put together every 3 years. So having the opportunity to hear directly from you on that, I think, is helpful. The issues you talk about are ones that we talk about in this committee all the time. We thought that it made sense to open our window, our availability for you to hear a presentation. So with that, I will turn it over to you.
Okay. So many microphones, so little time, but I'll go ahead. That's all right. First of all, a thank you, appreciate this. This came as I was doing a presentation recently about this process, and we thought, definitely pertinent for you to know kind of the process that we followed in the healthcare world, and then certainly to look at any ways that we could work together to benefit the community. A couple of things that are being passed out, I'll speak to these. One is a lengthy report that is the Community Health Needs Assessment. And it is the collaborative work of a lot of different partners that we call the Partnership for a Healthy Community. So I want to talk a little bit about the process that got us here, and then I'm going to land with the 3 priorities we identified out of our process and the focus areas, because I think, first of all, for your own knowledge, but there are probably some areas that we could look to collaborate as we go forward with this. If you can, to the next slide. So, first of all, why? Why a community health needs assessment? There are a lot of assessments done. This is the one specifically that is a requirement of hospitals and health departments. The primary purpose is to just make sure that we're in a process of regular assessing and improving the health of the community. In addition, this also fulfills requirements that we have from the Affordable Care Act. So the partners are listed in length in the full report that you've got, but I'll highlight Ascension St. Mary Hospital, the Kankakee County Health Department, and Riverside Medical Center, all represented here tonight. And Kara asked me, she said, why are there dollar signs next to those? The reason being because we are the 3 organizations that equally split the cost for the needs assessment. When we do that formal process, we don't ask any of the other community organizations to pay as part of that. We share that cost between the 3 of us, but we invite as many community organizations to be part of this as would be interested. The other thing that's important to note is we worked with an outside contracted group called Metopio, which both does some facilitation of the process and also provided us with a lot of data that we needed relative to the process and making sure that we had that data as we were referencing the priorities. So this is a really quick look. We followed a formal process called MAP 2.0. So there was a MAP 1.0. They updated it, and actually it put together 2 assessments into 1 assessment this time. So we followed the MAP process. MAP stands for Mobilizing for Action Through Planning and Partnerships. And you'll see next that we had a community partner assessment, a community status assessment, and a community context assessment. So we started with a community survey. And you can see there the timeline, the surveys collected. We next went to the community partner assessment. We did stakeholder feedback during that timeline. The community status assessment, which was secondary data, again procured by Metopio. And then we had the community context assessment strategic session back in March of 2024. Out of that process, we identified these 3 areas of priority and the listed focus areas underneath those. Chronic disease, which though we have called it different things, each of the planning cycles, chronic disease has always been in the center of our health assessment, as you would expect. Probably no concerns, no surprises, I would say, as you look through that list. Heart disease, cancer, stroke, respiratory illnesses, and Alzheimer's disease. Secondly, behavioral health. Again, probably not a surprise. Dealing in the areas of substance abuse, mental health, trauma awareness, and prevention. And then third, this is a new category of priority for us. social determinants of health. Now what is becoming a very common phrase that addresses a lot of different things. And while the list could be much, much longer, our areas of focus are food, housing, transportation, injuries, and healthcare affordability. So let me pause there real quickly. Again, this is what we derived based on all those processes. We reviewed the data, what is it telling us, and we said these are the areas that we need to be focusing on. Any questions at this point? Okay, any surprises? Okay, unfortunately no, right? These are the areas when we would assess, this is what we would find. Let me talk a little bit about next steps for us. And that really is about the implementation plans. So there's two parts for hospitals. Part one is, at least every 3 years, we need to go through this formal assessment process and land with areas of focus and priority, which we've done. But each hospital needs to produce an implementation plan. So St. Mary's began earlier in the year because their cycle in their governance year changes in the summer. So they completed their process with their implementation plan that was formally approved by their board back in the summer. Riverside did its, and we passed it this fall. We will begin our implementation plan in January. And then the Kankakee County Health Department has what's known as the I-Plan, which is on a little bit of a different cycle, but because they partner with us, they utilize the same community health needs assessment that they apply to their I-Plan. So that's kind of the process that goes forward. The other document that I've handed out is the implementation plan of Riverside. So I'll mention a little bit about how it's structured. It's designed to be very easy to follow in this regard, but you'll notice at the top that it does indicate a 3-year cycle. So it's looking at how are we going to address these issues at Riverside over the years 25, 26, 27. And as you've already done the math on, in 2027, we will be assessing again to get ready for the next 3-year cycle. You see then it's organized by the first priority, chronic disease, and then you can see the focus area, heart disease. There's a narrative there about the things that we'll be doing and that we're currently doing for heart disease. Next you see cancer and on down the line. Then you see the second priority, behavioral health, the third, social determinants of health in each of those areas. So this is an example this is our implementation plan. Both of these documents by requirement, and it's the right thing to do, these are available now on Riverside's website. We would make them available to anybody because we certainly want to be transparent in the process and let the community know what we're working on with these priorities and how we intend to go at it. So let me pause there. Any questions?
I do.
Yeah, go ahead.
This is a community-wide, so county-wide, not just Kankakee, correct?
Yeah, good question. Countywide, which Riverside would call its primary geographic location, would be countywide. I believe, and I'll check with Mr. Story, countywide would be St. Mary's primary geography as well? Okay. So yeah, we overlap, which is one of the reasons we do this collaboratively and do it together.
Thank you.
Good question. Good. And at this point, Mr. Story, do you by chance have your implementation plan that you'd want to share, or do you want to make comment about it?
No, I'll just stand here and say, apologize to my colleague who was going to make the presentation on our community implementation plan. Unfortunately, she has an emergency with a 13-year-old who's having some serious problems, and I just literally left them at the hospital. But we're deeply committed to this plan going forward, and we are working in collaboration with our colleagues at Riverside to improve the health status of the community that we serve collaboratively together. So that's the good news, that we're in lockstep with each other. The plans might be different, but the 3 primary objectives, we're committed to work together on going forward. And we all know, especially when we talk about behavior health, the challenge is that not only does Kankakee as a county as a region have. It's a national challenge when we talk about behavior health, and we've heard the president and his address that issue in terms of substance abuse. So we're absolutely committed to working together to try to mitigate this terrible disease in our community. So that's the good news. Thank you.
Thank you. Couple things I'll mention. A little bit of the how. As I mentioned, we've got those 3 priority areas. Do you mind putting that slide back up again? Thanks. And I want you to know how we as a partnership are looking to address this. So with chronic disease, and we're going to do our work a little bit differently this cycle. With chronic disease, as you can imagine, the hospitals and the health department are working on these all the time. We have people dedicated to these specific areas that are working on this from an expert level all the time. So we are not going to try to duplicate that effort with community subgroups. Does that make sense? Rather, we are going to keep the community group up to date. Each hospital, the health department, with our regular meetings, we'll just give updates on each of these topics and the work that we're doing to address these and prevent them so that that information is available. We looked at behavioral health. There is already a collaborative effort called the Mental Health Roundtable that is getting together about monthly, if not more often than that. That is a pull together of agencies throughout the community. We're not going to try to duplicate their effort. We're going to stay aligned with what they're doing. We'll keep updates with the work that's already going on collaboratively with that group. But social determinants, this is an area where our group has not gotten around this before. And so we're looking to pull together experts that are working in these specific areas all around the community so that we can talk about what are the areas and resources we need to share information. Many times what we find, I'll pick a moment on Barbie, who's often been part of these subgroups and has chaired one of these areas in previous times, in a previous life of hers. But many times what we find is when we come together, there's a resource on one side of the room and there's a need on the other. And so the first thing we start with is just saying, okay, what are you doing to address this? What are the resources? What are the solutions you're finding? We try to piggyback those as much as possible. And so right now we are trying to build the process by which we're going to make progress on social determinants of health. And what I would say is we would welcome the city to be at the table to learn from us and to learn with us, and that we can learn from along the way. I will mention, and I didn't look at the entire listing. Barbie, I don't know if you were at the March 21 meeting. You were not. I know the mayor was at that meeting, and so he represented the city at that time. But we would certainly invite any and all at our meetings when we start in January. I know Kara has set that date for us as we begin to go down this process with social determinants of health. Okay? I'll pause there unless there are any additional comments. Yes?
When we say that we are, this is for the community, how do we propose making sure that the community knows what's available?
That's a great question. I will tell you the answer we land with now, I'm not suggesting it's perfect. The answer we land with now is there are a couple of really good public resources that we try to stay aligned with and to inform. One of those is 211 through the United Way of Kankakee and Iroquois counties, which is designed as a social service access point. The other is a longtime resource called Can I Help? K-A-N for Kankakee, I for Iroquois, Can I Help? It's a website. Those stay aligned and those list out, as best we know it, the many resources which would address social determinants and social services in general and healthcare as well. But I'm always open to other ways that we can help inform the community, because that is always a barrier. How do people find information? I also work in marketing, and we're asking that question all the time. Good question.
I think, because a lot of times there's a lot of services available, but you don't know where to go to find the services that you need or that you want.
Yes.
So I just ask, how do you propose to get the information to those who need?
Yeah.
Matt, does the social determinants of health, I find it interesting because in public safety circles, I just went to a conference that was all about redefining the meaning of public safety and viewing economic development, viewing community development, viewing healthcare as important to arriving at public safety, and that those are all linked. This, in viewing it in this context, seems to recognize that improving healthcare requires all of those factors too. Is that part of something that's kind of new across healthcare in the country, or, I mean, where's that drive coming from?
Yeah, I'll speak to it a couple of different ways. Some of it is this process over time, not just locally, but in its broad intent, is designed to start helping us arrive at those conclusions, that we realize that healthcare doesn't just exist when one goes to the hospital, but it's involved in every area of life. And kind of the working statistic, I don't have the reference point for this, is really the belief is that about 80% of a person's health status is actually influenced by non-traditional healthcare related things. So where somebody lives has much more of an impact than necessarily where do they go to the ER or find their primary care doctor, or if they have a primary care doctor at all. And so I think healthcare is waking up to the idea of as much as we can go out and improve the community, we're going to improve the health status, not just wait until there is sickness and address the sickness. And processes like this help us do that, but I think what all of us find is you kind of have to start laser focused and small, because it seems like an ocean to boil, And so you go, well, if we can improve it in an area, then how do we learn from that and broaden that out? And so again, as we go down this road, for us in this regard, it aligns with, I know, what a lot that we're seeing at Riverside. So the people that are coming through Riverside's ER, we have social workers that are addressing a lot of these kind of needs. And we've been solving it in different ways, but we need a broader way to do it. Sorry.
In the social determinants, I see that healthcare affordability is a big, and it really is, because so many people don't even have insurance simply
Right.
because they can't afford it.
Right.
So is this one of the things that might help that?
Yeah, and to your earlier point, you asked the golden question about how do we get information out there. I know both hospitals demonstrate on an annual basis how much care we either give away or subsidize every single year in this community. I can speak to Riverside's number. In 2023, the last full year that we were able to assess, that number was $68 million in a single year that Riverside gave away in free and subsidized care. So that's one big way to get at healthcare affordability. We also have resources when a person comes in and they say, I don't have insurance. We want to help them find insurance if possible, to make sure they're covered. But if they're not covered and they come to us, we're going to look for a way to make sure that we treat them like we would anybody that comes through our doors. And so we want to get at healthcare affordability. We want to get at those things that are preventative more than reactionary. We want to catch things before they become chronic, before they become acute for the person. But it goes back to that earlier thing of how do you get the information out there? I know that, again, our marketing department is looking at, we use everything short of a carrier pigeon to get the information out. A lot of times, like a lot of things, but healthcare is often about when you need it, now you're looking for it. But if you'll look for it, because I look for it all the time, I'm a nerd because I follow healthcare marketing. If you drive up and down Court Street, you'll see billboards. Riverside is one of them that's putting billboards out with healthcare messages, but a lot of us drive by the messages we're not looking for at the time. billboards, social media. We still do newspaper and radio, and we try every which way we can, as well as being involved in the community just to stay top of mind. I gave you a long answer there. But the affordability issue is something that we want to partner with each person to help them find the best situation for them. We have a resource. When people come to Riverside, we can help them get connected with an insurance product that might work for them.
You know, I hear that, but I also know that, like, when you go to the hospitals and have to have services done,
Yeah.
it's very confusing because, for one thing, you receive so many bills from so many different areas
Yeah.
until you're thinking, oh, I can't afford this and I can't go back
Right.
for this, that, or the other.
Yeah.
So a lot of times people let the issues become major because now I have this traumatic bill and I can't pay it and I don't know what to do.
Yeah. Yeah. I will tell you, at Riverside, every bill has a phone number for patient financial services. The best way to handle that, and I'm just sharing it with you so you can help share when somebody brings this
Absolutely.
to your attention. The best thing, when a family member calls me and says the same thing, I say, call patient financial services. There's an individual on the other side who's an expert at helping that person navigate their particular circumstance. That's the best way that I know of. We have that information available on our website, things like that, but it's so personal that we always want to route people to that particular resource.
Okay.
It's a great question. But as we look at healthcare affordability relative to this focus area, goes to your earlier question. We'll use every way to get that information out. We'll look at it fresh, and we'll invite new ideas. Good. Thanks. All right, Kara, did I miss anything? All right. Mr. Story, did I miss anything?
No, I just wanted to add, if I may, the St. Mary's plan is also on its website, so I didn't reference that earlier, so please note that as a point of information. Thank you.
You just have to search Ascension St. Mary's Kankakee CHNA.
And I will follow up with Alderman Barron and let you know the date when our group is going to get together. And if that would want to be shared, again, we would invite anybody to join us just to sit in and see how we do it, share information, pull information from what we're sharing that day. We certainly would invite that. And I want to say thanks for the opportunity to present this. Look forward to what we might be able to do going forward.
Thank you.
Thank you very much. Any other questions, comments at this point? Okay. Thank you very much. Thank you all for being part of this. You are welcome to remain for the remainder of the committee meeting and beyond, if you'd like. With that, we'll move on to the departmental report for ECDA, brought to you by Barbie and Maya.
Thank you very much. So we printed out and handed you copies of the most updated project list for ECDA. So you can take a look at the addresses. We're trying to list the wards to make it easier for you to find projects in your ward so you know where we're at with those applications and those projects. So feel free to take this with you if you have any questions on specific projects that are going on in your ward. If you shoot me an email or a text as those questions come up, but just wanted to make sure that you got the most recent updated copy. And I'll give you a moment. If you have any questions, I can try to answer them here. As you can see, there's a lot moving, even though it's winter time. Yeah.
Barbie, can you remind me what SFRP is?
Yeah, single-family repair program, or rehab program.
Okay.
Yeah. Emergency repair program, single-family rehab program.
Just for my information, the last one listed, it's the same address? Do they have 3 different projects?
Yeah, there's like a roof and then inside and then foundation going on at that property. So 3 different contractors. We separate that out so that we can manage the contractors and their contracts and their schedules of work.
Thank you.
Anything else on that? All right. So just moving to the report, the addresses that you have in that report are going to be within this report. So our November update of what we've got moving for the lead program is in there. This has been slow going, but we've got some projects we've got a project into contract, others into environmental and historic review. So we're starting to move. It's been a long time of training and getting up to date with this transition, but starting to see some work going and looking forward to that picking up in the next couple months. Healthy Homes is active and firing on all cylinders, and we will continue these rehab projects throughout the winter as long as they're inside. So we've gotten this moving. And as you can see, we've been able to get some from the wait list from Healthy Homes moving into the intake, which means we can hopefully move people out of the wait list and into a rehab project. So good sign for Healthy Homes. Our CDBG program, if you can see there for our housing rehabilitation program, that SFRP, there's 6 active projects in there, and there are 4 from the wait list that are being reviewed. So did I get that right? The 4 that are being reviewed? Okay. And then if you want to take a look at our public service, where we're at, there has not been any drawdowns yet, but these are the allocations. We are into that time of year with them where we'll start seeing some packets coming in, start drawing down money. Usually they wait to the end of the year, which is April for us. It's usually when we see these drawdowns, but just still keeping it on the radar so you can review them. Any questions about those projects? Again, those addresses are on your list. Our ARPA programs, we still have the MIRA, the rehab program going on there. Round 2 of that, so we have 4 projects that are moving forward, and then we have 2 that have completed, and then we've got 2 in the income review, and then there are still 10 that are on the list to get to in the next 2 years. Hopefully we'll get to it next year, but we do have until 2026 to spend the rest of the funds allocated for this program. So moving with MIRA, again, those addresses are on your spreadsheet so you can see where those projects are at. Private security camera program, I sent an email out to all of you last week with the updates about the camera program. Working on the review of all the digital side of this program. There's a lot going on with those updates. So the application and all of the media around this we will work on. We are still getting applications turned in, and like I said in that email last week, we will process the ones that are for cameras only, and we will then, as we are upgrading all of the internal processes for paying out things with the comptroller's team, we will then process all of the lighting and camera applications that we get at the end of the month. So please direct any of your questions about that program in this time of transition. Just direct them straight to me, send them to my email or my work cell phone. I will get to your answers and questions and work with the residents who have questions as well. A couple of people have had questions that will we pay the monthly subscription fee? That's not what this program is for, so we aren't doing that with this program. So, but that did come up last week too. Any questions?
Barbie, did we come to a decision on where funding for this is coming from?
Yeah, thanks for asking. So ARPA meeting, it's from the public safety camera allotment that was already discussed. So that is what I was also told last week from the mayor's office. Any other questions? Okay. Moving forward, outreach. All the usual things going on with the newsletter and social media. I know you guys are following us, but I just want to talk about Neighborhood Walks Initiative. Thank you so much for approving the acceptance of the $7,000 from the American Lung Association for recognizing all of our work with the Neighborhood Walks Initiative. Samantha Rucknowski does a great job of planning that, communicating, getting other entities to support this program, and just being recognized and getting some money to help us expand and enhance the program is really encouraging to the team. It's a lot to be able to do this and get out into the community and walk the neighborhood. So very grateful for that. But also just want to say, we're over the 6,000. We've gotten to 6,000 homes in the city in this last year. It's quite an accomplishment. The team, led by Samantha, is doing one last push this week. If we can get, I think it's like 122 houses, then we will have hit 2,000 more than we did last year. So we're going to do a push, even though it's cold out, and Friday we'll take a walk and see if we can get it done. I'm very proud of the team for this. It's, just to get out and the work that goes into the bags and communicating to the other organization to contribute the resources. It's a lot of work in the office, but the return and payoff is great, and we're able to get information out. As Matt brought up that question of, how are we directing information? Both hospitals contribute to this program a lot. They give us resources to put into the bags that are going into people's homes. They help us with getting that information, sending us, printed materials on top of printed materials every week. So we're grateful to have that kind of support, not only from the hospitals, but every organization. So this is our last meeting for this year, and I just wanted to point out how proud as a director I am of the team for this, but also the community, and I look forward to next year really enhancing the program and being able to make it better. Yes, Alderwoman Noble.
One question. You talk about how many homes you've been able to go through. I was asked by a church.
Yes.
Are you talking to the churches or delivering to the churches also?
So we have not included that in the past.
Like that information.
You brought that up. You also brought up the senior high-rises and senior facilities, and that has not been on our list. In our strategic planning session in September, we talked about ways to enhance that. I got your feedback as well, and we put that on there. So it'll be one of the things that we look to improve for next year, definitely to add that, and naturally that will increase our reach by adding those facilities and entities. So we haven't thought about the organizations like churches in that way, but I do see the benefit of communicating with them as they have congregations and people as well. So I appreciate your feedback, and when we get that, it does kind of light a light bulb within us of, that's one thing that we can do more. So keep it coming. I don't know if you want anything to add, as you're on boots on the ground on this program a lot.
Not necessarily to add, but just to emphasize, the number that Samantha has been putting as her goal is, so if you look at census data, there are 10,000 housing units in the city of Kankakee, but based on mapping when it comes to accessibility to units, for example, it's a little bit harder to get into apartments or high-rises and things like that. So the census includes all of those numbers, but this 6,000 and the number that we're hoping to get to by the end of the week is every easily accessible home in the city of Kankakee. So again, it doesn't hit that census number because it's not the high-rises and the apartments and things like that, but it is every easily accessible census-counted home in the city of Kankakee. So that was a huge goal, and once we started getting closer, it became almost a necessity for us to get to. So as Barbie said, we're just really excited to be able to get to that point.
Thank you.
But
go ahead, sorry.
I'm sorry. Now that you mentioned that, the seniors do figure that they're missed out on a lot because nobody does come there, but they usually have like a monthly senior meeting or something. So if somebody was able to attend one of their senior monthly meetings at a senior building or some facility like that, and then give them that information, that would be.
Thank you for that. Within the email that was sent to you today is the minutes from the Continuum of Care meeting that was earlier in November, so you can see what's going on in those housing agencies. And there has not, K-Cole as well. And we do not have any minutes from the Hispanic Partnership meeting to share with you. So in that email is all the updated notes that we do have available. So take a minute to read through those when you have a second. And that is it for me for this report.
Any questions for Barbie or for Maya? Barbie, is K-Cole organized around a certain subject matter area, or is really just communications experts?
It's outreach coordinators from lots of different organizations across the county, similar to Samantha Rocknowski's position, and they all meet together monthly to share resources, talk about what's going on in their agencies, to be able to collaborate better, and then understand where they can make referrals to different people that they're working with if they need to. Also an opportunity to get their materials so that we can put them into our neighborhood walks bags.
Look like the attendee list is growing.
It is growing.
Yeah.
Yes, we're getting more and more participation.
Any other questions, comments? Okay, thank you very much. With that, we'll go on to old business. Is there any update with respect to the HUD Continuum of Care?
I do not have one, if Maya does.
We just got an email from the rep that we've been working with the holidays. We're rescheduling or reconvening now about getting something on the calendar to look over the current data that we have so that we can move forward with a cleaner scope of our data. So we're in the details part of it to kind of set us up to see what our next steps are.
Okay. Any questions, comments? Go on to Community Advisory Board, where things stand.
Yeah, so we are still working through the names and the lists of people that you have given us and making sure who is available and who can confirm. Still have a couple of wards that I need to get with. Didn't get any names from as of yet. So I will work through that. We can talk after this meeting. But we are still trying to work through confirmation. This is a priority for me to get done in the next 2 weeks because we've got to get this moving. January's coming, so.
Is, and we skipped over it with the public service, it slipped my mind, but the public service meetings for the new allocations are this week. So we are going to do that first round as a team of just talking to the agencies about what the program entails, and then CAB is going to be a part of the process of reviewing those applications once they come in. But the informational meetings that are mandatory for anyone wanting to apply for the funds are Tuesday and Thursday this week. There's an afternoon time and an evening time. I apologize off the top of my head, I don't know the afternoon time, but the evening time is 5:30.
It's 5:30 p.m. and noon on both days.
Simple enough.
Barbie, what if we don't have the CAB appointed in time for public safety?
We'll have to adjust the timeline, but we have to get it done, yeah.
We can't go through the old system? Okay, so that just underscores the need to get our names in and help make those appointments, I guess. Anything else with CAB, comments, questions? All right, and then the only thing on new business, Maya did provide some of the details about CDBG Public Service Program update, so it's Tuesday and Thursday of this week, tomorrow and Thursday.
Yeah, noon and 5:30 p.m.
Okay, anything else with that?
No, just that if you're interested in applying, emails have gone out to agencies, there's been communication, so if they want to apply, they got to come to these meetings so they can get all the information, so we can make sure everybody's in compliance with the federal funding guidelines, and then also pick up your application. We want to physically hand it to you.
Do we know the dollar figure that we have to allocate this year?
No, not yet.
Okay. Last year it was around 70, 80?
Yeah, we'll know at the end of this month what we're going to be able to pull from, what the pool will be.
Okay. All right. With that, no need for an executive session. Do any older people have any comments, questions, complaints?
No complaints.
All right. If there are none, I will take a motion for adjournment.
So move.
Motion made by Alderwoman Johnson, second by Alderwoman Noble. All in favor, please say aye.
Aye.
All opposed, nay. We stand adjourned at 6:48.
Thank you.
It works, though.
They ain't started yet.